In microsurgical endodontics, every second counts and every instrument counts. And that's why I developed the Nasseh Microsurgical Kit, which is a compact set of 18 instruments designed to simplify surgery, reduce clutter, and also to make the outcomes more predictable. Let me walk you through this kit the same way you'd be using it during the operation. After unboxing and assembling the mirror and the micro mirror heads, what you're going to do is you're going to go through the different phases of the surgery. Exploration and access. So we begin with visualization and diagnosis. The lightweight rhodium-coated mouth mirror produces a high-resolution reflection without distortions and cleans also very easily. The round handle scalpel holder allows excellent grip and also the ability to maneuver the scalpel head with precision. Now, this round design, in my opinion, is a little bit better than the rectangular design because it helps provide better maneuvering for scalloping submarginal incisions. The combined DG16 Explorer and the UNC15 PerioProbe serves as a dual-purpose tool on the same instrument, combining a 15mm probe with an Explorer, saving the additional instrument in the kit by combining these two crucial instruments diagnostically on the different ends of the same handle. The Explorer is clearly for detecting fenestrations and also feeling your way around the crypt, while the probe is used for the measurements of the cutting links during the procedure. By using the surgical ABC technique, which I've described as a technique for optimizing your CBCT pre-treatment planning with your surgical procedure. Together, they set the procedure for a precise microsurgical access, flap design, and reflection. Now, once the flap design is marked, flap decision using the scalpel handle and then careful reflection provides the need for a good access to the surgical site. This is why I have 3 different elevators to the kit dedicated to reflection, which I've noticed is actually the part that most novice surgeons struggle with. This versatility provides the surgeon with precision and control in various situations based on the specific flap design. For advanced microsurgical flaps, the Boozer elevator here helps early elevation of the flap edges with a lot of precision. This is very important as it preserves the periosteum during the reflection. Then either the periosteal 2-4 or the Molten 9 elevator allows sharp dissection and also delicate tissue handling for final elevation of the flap. Once the flap is fully reflected, the 2 Minnesota retractors here hold the flap back while you drill a small little hole, 2mm hole, in the bone where you want to place the notch for this Nasseh Minnesota retractor. This helps stabilize the flap in place and will be the subject of more detailed tutorials later on. Once the flap is reflected, the Sabetti curette efficiently removes any granulation tissue and also enucleates any cysts with its dual-sized tips, ensuring the crypt is completely clean prior to any grafting procedures. Curettage and access refinement. For meticulous finishing around roots and removing little tissue tags, the Columbia curette allows controlled debridement of the cyst and other small granulation tissues. Now, this allows curating around root ends, while the Sabetti and also the Columbia together work synergistically to curette out any granulation tissue or cysts from the crypt. Root and preparation. Next, we move to the apical preparation and visualization. The high reflectance micro mirrors here can examine the retropreparation one last time before the retrofilling. The 2 ends can accommodate different crypt sizes, as well as the black coating of the instrument handles helps reduce light reflections that will help reduce eye fatigue. After the retropreparation with an ultrasonic, the endo microplugger steps in to verify the depth of the preparation and also tugging any loose gutta percha, followed by compacting the putty or any other retro material that you want to use if needed. The root end treatment and perforation repair instrument acts as a micro spatula with a straight and an angled end that helps deliver the putty or your retrofilling material into the retropreparation area. This is the cornerstone of the lid technique. Now, the visibility is enhanced with the 2 micromirrors throughout this portion of the procedure, retraction and tissue management. Now, to maintain a clear and stable feel, the pair of tissue pliers provides a firm but delicate grip. Retraction is managed by Minnesota retractors, and my modified version, this small protrusion locks into bone to prevent slippage and also to reduce operator fatigue during long procedures. Now, this innovation makes a dramatic difference in comfort and control, and I'm also very proud to have developed this little small modification that, in my opinion, makes a very big difference in tissue management throughout the surgery. Grafting the site. Now, we all have our own grafting preferences, but this Pritchard elevator is generally used to carry the bone particles to the osteotomy, and this other wide end is used to maybe protect the graft area while the assistant suctions any of the loose particles around the area. Finishing and closure. Now, once the retrofill and the grafting is complete, precision suturing becomes the focus. The Castroviejo needle holder in this kit gives fine control for delicate microsutures, while the straight iris scissors provides clean and sharp cleaning and cutting and trimming to complete closure with accuracy. Now, the Castroviejo's size was chosen to accommodate both the FS2 and P3 needles, as well as any other needle sizes used in apical surgery. The system. All of these instruments are organized in a compact, sterile tray that keeps them sterilized and protected and ready for use. The tray is an efficient, open-faced system and helps reduce clutter, and it allows you and your assistant to always have the right tool at hand. The Nasseh Microsurgical Kit was built on one principle: less is more. By combining multifunctional instrument, also industrial design, and modern bioceramic techniques, this system powers clinicians to work faster, safer, and also with greater precision. The future of endodontic microsurgery is simplicity. A compact, efficient, and designed by a surgeon for surgeons instead of tools. I will share more detailed tutorials with you guys down the lines, especially on reflection and retraction using these novel tools, so be sure to subscribe to this channel so you don't miss them. See you guys in the next video, and until then, let's save some teeth.